Welcome back to Season 7 of the ReidConnect-Ed podcast, co-hosted by myself, licensed psychologist Dr. Gerald Reid, and my sister, educational therapist Alexis Reid, providing resources on mental health, education, and performance psychology. Today, we are so fortunate to be joined by Dr. Susan Faja, who is a psychologist at Boston Children's Hospital, specializing in the research of individuals with autism. The Faja Lab, led by Dr. Faja, seeks to understand changes in brain systems of executive control, social cognition, and social perception, resulting from targeted interventions that use electrophysiological as well as behavioral measurement tools. She leads the Faja Lab, where her approach allows for the exploration of the developmental processes that contribute to behavioral symptoms, clarifies how interventions work, and provides a platform for rigorously testing novel interventions. Additionally, Dr. Faja seeks to understand why and how individuals with autism can present so differently in their development as a way to better understand causes and inform individualized treatments.
So let's briefly review Dr. Faja's credentials. Dr. Susan Faja studied neuroscience at the University of Michigan before receiving her doctoral degree in child clinical psychology from the University of Washington in 2009. She completed an internship at UCLA in the developmental disabilities track and postdoctoral fellowships focused on clinical neuroscience at the Children's Hospital of Philadelphia and the University of Washington. We're so eager to have this chance to speak with you in a long form about autism. There's always been such a keen interest in autism on so many levels, from causes to presentations to how we can support individuals. We're so grateful to speak with you today and for you to provide our audience with some helpful information that they can turn to. So my interest, of course, is in executive function and learning, since those are the skills that I support in the learners I work with. But I'm so curious to hear more about the work that you do.
Thank you so much for joining us, Susan.
Thank you. It's so great to be here. I'm really excited about this conversation.
Yeah, I think one way to start this episode, just to orient the audience, I know we talked about executive function a lot on our podcast with Alexis and myself and other guests. Can you share, how do you view what executive functions are? It's kind of this term that people may be like, executive function, what does that mean? Executive like a boss? What does executive function mean exactly to you?
That's a great question. I like your reference to executive function being kind of like a boss. I do think of executive function a little bit like what you imagine a cartoon brain doing, of just kind of being in charge of everything else. So it's like the boss of your brain. It's a set of thinking skills that we have, and we use those skills to respond to new situations that we haven't encountered before, or when we're in situations that require some sort of strategy or complex response where we have to kind of put some pieces together.
Interesting, yeah. In a previous episode, Alexis and I talked about this, and I was remembering the Simpsons cartoon. And remember Homer Simpson, when he would make a mistake, he wouldn't inhibit himself, which is an executive function skill. He would hit himself on the forehead with his hand. And I'm like, Lex, that's where the executive functions lie, in the front part of your brain. What a great
Wake
depiction.
up, it's time to do what you need to do.
So Susan, can you share how executive function looks with someone with autism? And I think the layperson may have a general idea of what someone with autism may look like or present as, but maybe not see the underlying skills that can essentially manifest into behaviors or different ways of relating that could seem different, perhaps.
Mm-hmm. Yeah, so I think in autism, some people don't realize that individuals on the autism spectrum can have difficulty with executive function. But what we know from research that has kind of looked across all different studies that have focused on executive function in autism, that there are some patterns that emerge in the most common profile. And so let's start there. So on average, what we see for people on the autism spectrum is that there are difficulties with sort of the highest level aspects of executive functioning. So when we talked about how we use executive function in situations that require planning or strategy, those planning skills are the things that come up on average across the most studies and with the biggest effect. And what that means is that it's probably because there are different profiles of executive function challenges with some of the other executive function skills that feed into into that planning ability. And so for individuals across the spectrum, we might see somewhat different profiles. But if you have other kinds of executive functioning challenges, they're going to impact your ability to plan or problem solve in a strategic or efficient way. So when we see someone struggling with executive function, maybe they're doing things more slowly or in a way that's not maybe the simplest or most straightforward or fastest way to get a problem solved. It may be, sort of lead to an interesting or creative or sometimes even better solution, but it could take a long time or maybe less direct. So I'd say that's sort of the average profile. But one of the interesting things is that we can see different profiles for people on the spectrum, and I think that's important to remember as well. So when we look at an individual level, we may see challenges with certain aspects of executive functioning, like working memory, which could impact our ability to kind of integrate information in real time. Or things like shifting, so our ability to kind of go back and forth between different ideas or different strategies. Those are some of the other kind of more common ones across studies that are affected in terms of the skills or the profiles. But we also see that some individuals on the spectrum have absolutely no difficulty with executive function. And so that's kind of an interesting piece of the puzzle and an important one to keep in mind.
Oh, interesting. Okay. I want to pick apart one thing you said about planning kind of being one that is kind of global, that a lot of people with autism tend to struggle with planning. And you said it's almost like they're not necessarily looking ahead and then working steps backwards. So what could that look like if someone's working on a task? Is it kind of like they're just focused on the present moment so much without thinking ahead and then using what they're thinking ahead to inform what they're doing now?
Exactly. Yeah. So it could be kind of getting stuck on one part of the problem and not kind of thinking about how to move, what's the big picture? What's that long-term goal? It could be just, being very detail-oriented. It could be kind of taking whatever strategy pops into our head first rather than kind of evaluating which strategy would be most effective.
Interesting.
I think it's so interesting because, planning from an executive function perspective too, I always break it down into thinking about we can plan how to accomplish a task, but there's so many life skills related to planning too. Like how do you think ahead for what or anticipate what you might need when you need to make a change or a shift? And I think one of the difficulties in even discussing executive function for folks to understand it is that like pretty much everything in our lives kind of comes back to executive function skills. So for individuals with autism in particular, I wonder if we can kind of go down this planning path a little bit more, because I think it's so important for folks to recognize, and especially caregivers and educators who work with folks on the spectrum who often have some really great strengths and abilities, that they might forget that this is a skill that's so important to be developed, scaffolded, and supported.
I'm still thinking about your comment about thinking way down the road. So one of the things that I hear from autistic people, and just thinking about what this might look like in real life, is that there's a tendency to be very in the moment. And so thinking about what's right in front of me and the part of the problem that I'm solving right now, or the materials or information I need for right now, and not necessarily being able to jump back and forth necessarily as easily into the future, or kind of put those pieces together in that longer view. And so I do wonder how that may interact, in terms of that right now, which, it can often be very helpful to be very mindful and present. But I think executive function allows us to step outside of that present and do what we call metacognition. So thinking about our thinking and thinking about what's going to be required, either coming at the problem from different angles or thinking about what the next steps might be in that problem.
Yeah. So this, you can see this manifesting perhaps with a child who is having a hard time moving away from something because what they're doing is not working. And that seems to be like a pretty prominent feature of someone with autism, is they kind of call it getting stuck or inflexible. And so the difficulty with planning, and Alexis, I like what you said too, is that planning also involves what your needs are, and what your needs are in the moment may not be what your needs are in the future. And you may not get your needs met if you're not seeing that in the future you may need something different from what you need right now, which is definitely can happen.
Yeah. I think another thing that I hear a lot about and see in some of the autistic people that I interact with or their families is organization. And I think that, again, that planning kind of comes along with being organized or appearing organized to others. So just kind of thinking about, what am I going to need an hour from now or tomorrow? How do I kind of want to set up my environment to, to not only be like right what I need in this moment, but, in other situations, or if someone else had to kind of like understand my organization, what would that look like?
Yeah, and being disorganized definitely makes it hard to plan ahead if your mind is just disorganized and having a hard time figuring out what to do next.
Yeah.
It definitely makes you overwhelmed and anxious for sure.
One of the pieces of executive function that my lab is most excited about is pretty related to organization. And so we're really interested in how executive function contributes to being able to filter out information. And I think that kind of filtering or directing your attention to different things is a piece that is also very important and seems pretty intertwined with some of the features that we see in the autism profile.
Yeah. Can I ask you a question? You made a good comment previously that sometimes this way of thinking, we kind of think of strengths and weaknesses or vulnerabilities, however we want to describe it. Depends on the context, right? One person's weakness could be a strength in a different context. You made a comment that thinking this way, being really detail-oriented, or just acting on any thought that pops in your head could sometimes lead to a creative idea. Is that maybe like the flip side or the mirror trait of this challenge that could happen sometimes?
Yeah. And I think being able to stay focused on something for a really long time can also be a huge strength. And that's something that I think a lot of people on the spectrum can really use to their advantage. And with the autistic people that I've worked with, it's really impressive, like how focused someone can be. And sometimes that level of focus is required to really get in deep and understand a problem and really solve it, or maybe like go at a level that might be less likely to kind of be understood. So I think that's it's sort of the two sides of it, right? Like, there's some advantage to being able to stay really focused and really in the moment. And then conversely, like to be able to say, okay, that's enough. It's time to kind of shift and do, come at this from a different way, or, to think about it in a different way.
Yeah.
There's so many overlapping features between the way we're describing and talking about autism and ADD and ADHD, right? Some folks might have difficulty filtering that. That was such a cue for me, filtering the information that's coming in to organize how we use it, what do we and don't we use, especially in this media-rich world that we're in. There's so much information. It's hard for all of us, I think, to filter information and prioritize what we need to use and do something with it. So I wonder if we could talk a little bit about that too, the differentiation between, say, executive function challenges coming more from attention deficit disorder versus autism.
Yeah. So this is a really active area of research, and we're really trying to figure out what that overlap is, because with the new diagnostic criteria that came out in 2013, it was the very first time that the field was really allowed to think about that overlap between autism and ADHD. And so we know that executive function challenges are not unique to autism. There are certainly executive function challenges in the profile of many kids with ADHD, or many people with ADHD or ADD. And so what that looks like and what that profile looks like is something that we're still trying to sort out, I think, as a field. We and others have tried to pick that apart. And, my lab did sort of a deep dive into the inhibitory control, including some of that inhibition of information that was coming in. But I think we don't we don't fully understand what that overlap looks like. I will say that there is a high level of co-occurring diagnosis of autism and ADHD. And I think in general, what the research would suggest is that for children who have both of those diagnoses, or adults, that you would expect to see more executive function challenges. Whether or not there are unique profiles, I think, the research is still a little bit unclear, although people are definitely trying to, again, look across studies and figure out what those patterns are. But in general, the level of executive function challenge will go up if you have both of those diagnoses.
Interesting. Yeah, it reminds me of how some researchers, I think, are trying to look at the overlap between ADHD and dyslexia, that there could be similar brain pathways and what that means.
Yeah.
Okay.
I just want to touch that on that again, because I think a distinction, and please tell me if I'm wrong, an important distinction is this like oversensitivity sometimes to the environment through our senses. Can you maybe talk a little bit about and I want to bring like the individual with autism into the room, right, to hear more of their perspectives, because you do so much work in really fully understanding their experience and thinking about how maybe just like different environmental features can really impact an individual on the spectrum.
Yeah, that's such a great question. And one that we don't understand fully yet. At the same time that the diagnostic criteria changed to allow that co-occurring diagnosis to be made, one of the other important changes to the autism criteria were that we started to recognize those sensory features of autism. And so we know from our diagnostic criteria that some people on the spectrum will experience more sensitivity to sensory input. They'll sort of be hypersensitive and maybe more distracted or more bothered by that kind of sensory input from their environment, which comes back to that filtering. There may be some executive function at play, either in terms of not being as able to filter out or kind of shift away from those kinds of environmental cues. Or it could be that there's something different about that sensory processing system that's overwhelming the executive function system. There's just too much information, and it wouldn't be possible for anyone's Homer Simpson, kind of boss brain to control that. So, it would be too much information for the executive function system to be able to filter out or, to stay focused in that situation. Conversely, there are some people on the spectrum who are less sensitive to sensory information. And again, I guess it brings up the question of whether that's a tuning, what's the interaction there with like the executive function kind of top-down control system that we have. And then, of course, there are people who have no sensory features because it's not required that we see those sensory features in our diagnostic criteria. And so some people on the spectrum don't experience any kind of sensory differences. And some people experience a mix of sensory experiences, too much or too little. So still lots of things to figure out on an individual level.
Definitely. And I'm asking a lot of these questions also from like an educator's perspective, because I'm constantly working in professional development settings, helping folks to think about how we can even use our environment to help support executive function activation, especially for those who have greater challenges or vulnerabilities. So, I'm thinking about the sensory piece and your work in filtering and organizing that information, and how important that is to even validate an individual that this is what's happening and this is what might feel more challenging. So I'm glad that we're having this conversation and breaking down some of these characteristics for folks to even appreciate the experiences.
Yeah, and it's not their fault, really, and there could probably, there could be frustration from maybe the reaction they get from other people or their own reactions to the situations that they feel out of control, or that, like they should be able to be better regulated and so forth. And so, it's an interesting kind of like human experience to be in that position where like, someone with autism is trying to go through the neurotypical world and try to, do the best they can essentially with the way that their brain is operating essentially.
Yeah. So I think, for people who are wanting to support autistic people in their lives or for autistic people, there are going to be a lot of individual differences here, but really trying to get as much information about what the optimal environment is going to be is really important. So, for some people, they may need more sensory input. They might need a busier environment to kind of be optimal. And for other people, it may be the opposite, that, they're able to use their executive function skills most when it's really quiet and free of other distractions, and they can focus on the one or two things that they're really trying to kind of problem solve with.
I always think of like the coffee shop situation, right? Like some people can sit in a coffee shop and read and write and produce, and other people like me, sometimes I'm like, this is just too much. I can't do anything here.
It's so true. I mean, working with some people who have been on the spectrum, and I think this is why maybe sometimes it doesn't get diagnosed, is that when they're in a certain setting, it's a one-on-one setting, I'm thinking to myself, wow, this person has a great ability to take my perspective or another person's perspective in a way that you wouldn't expect if they were on the spectrum. And to your point, are there certain environments where someone could thrive or at least have a higher potential of using these skills where they're less overwhelmed or what those elements are. So I'm really appreciative that you're looking at individual differences and for people in these kids' lives to understand the individual as much as they're understanding the diagnosis.
Yeah. And I think about that, the social piece is an interesting one because executive function is really closely linked to the expression of kind of core autism features. And we know that one of the really core features of autism is differences in the way that autistic people interact socially. And so my team and others have been thinking about how working memory might be related in those kind of face-to-face social interactions. And so when you're interacting with someone, often there's language involved, right? You're like listening to information and you're thinking about what they're saying and you're kind of making sense of that. You may be planning what you're going to say next, or you're thinking about like what that information means for you and what you'll need to do with that information. So you're already doing two things that you're holding in mind. And then you have to do all these nonverbal things. You have to kind of see what that person is looking at or paying attention to. And you may use nonverbal cues for that. And you may have to hold that in mind and integrate that. There may be emotions that you need to register and kind of, integrate. And so you're starting to load up all of those pieces of information. We use working memory when we're trying to integrate or manipulate information. And so being able to be ready to do the next thing in that social interaction really requires working memory, because it requires you to take all of that information that's coming in and kind of move it around in your head and then be ready to generate a response or plan a response that makes sense in that context. So that happens when we're adults and we're having face-to-face conversations, but it also seems like it's going to be really important in language learning. So when you're learning how to use language and what language means, what that person is attending to as those speech sounds are coming in turns out to be very important.
What they're focusing on, you're saying?
Yeah, what they're looking at, what they're paying attention to, what they're focusing on is really closely linked with what your understanding of the sounds that you're hearing will be. So we think that working memory can be really related to language development. And we're trying to kind of understand the interaction between language and working memory as we look at executive function in really young children on the spectrum in my lab.
I'm so glad you said that. And I want to come back. I'm just going to put a pin in this so we don't forget, because I was so excited to talk about, social interactions and executive function, because I talk about this all the time, because we tend to forget how much goes into just being face-to-face with somebody, let alone missing some cues like a lot of individuals on the spectrum might miss that others might notice in an interaction and how that can be misinterpreted. But the language piece is so fascinating to me. And maybe I've missed it, but I'm waiting for the research to come out from the COVID days where we were wearing masks all the time, where a lot of young people, especially those on the spectrum, weren't getting that additional information from, the way in which we furl our lips to make a smile or make a sound, and how impactful that is in integrating language into this whole piece of just developing language, but also in socializing. It's so fascinating.
Yeah, I think we get a lot of cues. So one of the things my lab is looking at is gesture use as well. And that's really what got me thinking about
as I'm using my hands when I'm talking.
Working memory. So yes, but it is important at certain stages in language development to be able to see what people's mouths are doing. So I think that COVID data will be really interesting. I haven't noted, I haven't seen those papers come out either. So
we'll have to share them as we find them.
To say about that. But yeah, I have thought a little bit about the impacts of if there's less information available, what impact that will have. But coming back to executive function, I think if you're less able to integrate that information, or less able to kind of shift back and forth, thinking about other ways that the executive function abilities may impact your social skills. You're constantly kind of shifting between your perspective and hopefully the perspective of the person that you're interacting with. And so that shifting ability and kind of being able to inhibit your own whatever it is you want to talk about or think about, or your own perspective, and kind of shift to that other perspective, I think is another piece of how those executive functioning skills may play out.
Can you drill down a little bit more on visual working memory? Because I don't think people even realize that that's a thing.
Oh, yeah. Thank you. So this is interesting. I'm glad you came back to that. There's some research that suggests that working memory can be kind of split into different kinds of memory. And so we can remember things that we hear, like I could repeat a list of words for you, and that would be like verbal memory. And then if you asked me to put those words in alphabetical order, that would be an example of how I would use my working memory skills in terms of verbal working memory. I can do the same thing with spatial information or with visual information. So I could take like objects or pictures and kind of remember what I see. And then I may have to do something like, if you show me a series of pictures, I may have to put them in order. Like if they were animals, like the smallest animal to the biggest animal. These would be ways that we would measure working memory. But in real life, you sometimes have to remember what things look like to be able to go back and kind of effectively move through your environment to get back to the things that you need to be able to find. So that's how it would kind of play out in real life versus how we would measure it in the lab. You can remember like the cupboard door looked like this, or it had this kind of a handle where I left my keys, or you could remember that I had to turn right and go down the hall to be able to get to it. So that's more like spatial memory. But we can test those things in the lab, and we use them in real life as we're kind of solving problems day to day. I think we use visual spatial working memory a lot at the grocery store. What aisle do I need to go to get this thing on my list? So I have 5 things on my list, and I'm kind of mapping the grocery store and then kind of putting things in order according to how quickly I can walk through the grocery store and get to the checkout if I'm in a hurry.
And then we add into it, the marketing campaigns and the flashing lights and the new boxes. And there's so many distractors in the environment. That visual working memory and spatial skills, I think, is so important. And often a lot of the people, I think, Jerry, you probably too, that I work with, struggle a lot with being able to integrate their visual spatial skills into real life environments when there are so many distractors. That could become so anxiety provoking that they lack the ability to integrate and use their working memory skills in these situations. And I know, especially individuals with autism, it becomes even more challenging and difficult, where it could turn into like more of a behavior and reaction and response to those situations. The
other piece that I think about that I do hear about a lot in terms of executive function and the different experience of executive function for people on the spectrum is that we use executive function in real life to accomplish goals. So when you were talking about young children, in addition to being good at kind of sorting things, a lot of young kids on the spectrum are actually really good problem solvers when they're motivated. And so we think a little bit about different aspects of executive function. So in my lab, we're interested in something called hot executive function, which is what we use in situations where there's maybe a more clear concrete goal or there's some sort of emotional consequence to the problem that we're solving.
So hot being the emotion, that's kind of where the idea of hot came from. It's more like emotionally driven, like motivated.
So hot executive function can be more emotional. That's kind of one way that we could think about hot. But hot also might have some sort of tangible reward. So it's in terms of the goals, it's going to make the goal more immediate and maybe bring up a little bit more internal affect about meeting that goal. The reward system is going to kind of kick in.
Which helps collapse that idea we said before about not always being able to plan for the future because it's more immediate in the response.
Yeah.
Potentially, right?
Potentially, right, exactly. But it may help pull someone towards that goal rather than staying, right in that immediate step of problem solving. So the thing that I think about is, I do an interview where I ask parents how their young child asks for help. And a lot of parents will say, my child just gets whatever they need on their own, whether that's climbing a chair to get the thing that's out of reach or figuring out a way to get the thing open that a lot of kids wouldn't be able to do. So I think there may be strengths there in terms of problem-solving skills that we don't see as often in our boring lab-based tasks where, there's no real reason to solve the problem. So I think we wonder about that for kids on the spectrum too, like our tasks capturing the full ability or the full range of skills that someone might have or be able to bring to the situation depending on the context.
Well, also that problem solving oftentimes involves other people. So I'm sure as you're saying, if it is a highly motivated problem to solve, they may solve it, perhaps though at the expense of relationships where maybe they're so focused on solving the problem, and they do, but the nuance of interacting with other people I'm sure there's examples of that, right? Like you kind of get what you want at the expense of maybe a relationship staying maintained because there could be maybe certain ways of solving it that doesn't, that maybe negatively affect another person without realizing that it is.
Yeah. Or to think about it, just to kind of think about it from a different perspective. If that communication with another person is something that comes less easily, it could be a really brilliant way to solve the problem by figuring out how to do it without that other person. So it's sort of applying the skills that are in your toolkit in a really effective way to solve that problem. So it's highly functional. It's not as social,
right?
But it's highly functional. So that's a really interesting thing to kind of think about that and how executive function comes into play.
I mean, in some ways, that's kind of what they're saying about AI, that it's just more efficient and doesn't require other humans, which is kind of scary to think about in some ways, but let's not get into that.
I was going to say, we talk about hot executive function. Can you also describe cold executive function too? Because with the hot also comes the cold.
Cool executive function. So cool executive function is probably a little bit more abstract. Like it's kind of those thinking skills more in isolation. So you're using them to solve a problem, but you don't necessarily know what's in it for you. It's just sort of a problem in front of you and you've been asked to solve it. And so in the lab, it's those kind of more pure kind of thinking tasks where we're looking at things like working memory or your ability to inhibit some kind of response or inhibit information or to use those shifting skills in isolation without necessarily having a meaningful consequence at the end of solving that problem.
Yeah. So it's making me think of Dr. Walter Mischel, right? And the regulation tasks and
the marshmallow test.
The marshmallow tasks, right? So this is the part of my course right now that we're talking about, self-regulation, emotional regulation, inhibition, how all of it plays a role, most especially in executive function. And I wonder if you can share some insight from the work you've been doing in the lab too about self-regulation and emotional control, potentially with regards to motivation too, when these children and individuals are trying to accomplish a goal or a task.
Yeah, so my lab was actually really curious whether we would see differences in those kind of hot versus cool tasks in the lab. We are currently finishing up a study with about 262 and 4-year-olds, including children on the spectrum. And we're really finding in that age range that performance on those hot tasks is related to how you do on the cool tasks as well.
Oh, wow.
So that was one of the things that we were curious about. And what we think we're seeing from our data so far are that the skills are really kind of hanging together. And so your ability to do those tasks like Dr. Michelle's task where you have to wait for a treat are actually related to your performance on other things like shifting or, remembering where things are hidden with your working memory or your inhibition skills without a treat that you're inhibiting your response for.
Yeah, it's so interesting. And it's such a hot topic in thinking about internal versus external motivators, right? To be able to work towards tasks. And, there's a lot of external motivation in the world. There's a lot of, like, when you're playing a video game, I can have a whole course on this, that oftentimes people, anybody of any age, when they're playing a video game, get a lot of reinforcement for accomplishing tasks that we don't always necessarily get the same in real life. And for individuals with autism, sometimes they get more reinforcement to help shape behaviors and work towards accomplishing goals and tasks. But I actually think it's an important point for all teachers and caregivers and parents to think about, like, how do we balance these internal versus external motivating rewards as we are working towards tasks? Because I think it's a tricky one. It's something I encounter all the time, whether it's in an educational setting or in my practice with families and individuals.
Yeah, it's a complicated topic in autism. But I think in general, when we're learning, there is some sort of reinforcement that goes into that learning. And I think at a most basic level, if I'm going to hold on to information in my mind, my brain is tagging that information as being important. It's kind of, it's marking that as something that's, that I need to remember. And that's sort of an evolutionary thing, right? Like in the past as a hunter or gatherer, I need to kind of remember where the food is, so it keeps us alive. But that's built into how humans learn. So whether that reinforcement comes because I'm excited that I figured out the problem and I just feel good about myself, or because I'm really interested in a particular thing and I really want to learn a lot about it, and that's an intrinsic thing, or there's a hook built into that mastery of the game I'm playing, or somebody is giving me some sort of external reward. I think all of those kinds of rewards could be helpful in terms of marking that information as being potentially important. And so, if I'm trying to learn how to do something new, or if I'm trying to shift my behavior, I sometimes can rig the system for a little while. So like now I'm trying to change how I go to sleep. And if I do a good job all week, I get myself a treat on Friday morning. And so those kinds of treats, I think, can be helpful, at least initially, if I'm learning how to do a new behavior that's not something that I necessarily want to do. So there can be a place for that, but I think we want to think about it across a wide menu of how we learn and how we reward that kind of behavior.
I do want to shift the conversation similar to what you're saying around relationships, because I think it's a topic that we can probably get more into, that I think people with autism, and by the way, do people with autism prefer person-first language, or as in a person with autism or someone who is autistic? I just want to get that out there as a sense, because I think could be differences perhaps in what people prefer.
There's a mix. Many autistic self-advocates prefer identity-first language, so an autistic person. But there is a range in terms of what's preferred.
Gotcha. So it's best to ask and in terms of being respectful.
Great question.
So in terms of relationships and socializing for someone with autism or autistic person, Can you just share your insights just about what it's like in terms of the executive functions and relationships? Relationships can fluctuate, can change. There's so much nuance to it.
I think with relationships and with people in general, people are unpredictable. So that requires some flexibility, some shifting, and it brings sort of extra challenges or demands to a situation. I'm thinking about what we know from the science, because I don't identify as autistic, so I don't know if I can really speak to what that experience is like. But there's been some work kind of looking at how we collect information about executive function as researchers, and we've thought a little bit as a field about whether collecting those experiments face-to-face, having like a researcher sit across from a child on the spectrum and administer those tests, whether that impacts your ability to demonstrate other kinds of skills. In comparison to maybe like on a computer, where there are no social demands in addition, and whether the social demands could be impacting our understanding of executive function. So I think part of the reason for that is that people can be sort of unpredictable and inconsistent as well. And so it's requiring a lot more attention be shifted to that social interaction.
And would you say it's fair to make the statement that someone with autism may lean towards wanting kind of a black and white way of thinking, like there's a right or wrong way of doing something or right or wrong answer to something, and in relationships there's so much nuance about, is there really a right and wrong way of doing something, or, kind of that rigidity in nature, which could, fall into the camp of having a hard time of being flexible in your thinking, right? So everything becomes a little bit all or nothing, black and white. How does this manifest, in terms of relationships? I'm just curious about this.
Yeah, I think, there's been some thinking that giving sort of clear guidelines or expectations could be helpful. I'm not sure over time if that's really what's helpful about it. I think it may be helpful because some of that information is less intuitive. And so it just makes something that's implicit more explicit. But I think there's not necessarily... Well, with human behavior, it's really hard to make rules about what's always going to happen. And I don't know that, with the autistic people that I've talked to, that's necessarily the expectation. But, what I do hear is that there may be a desire to be complete or accurate or sort of truthful in terms of fully responding to a situation or to a question. Yeah. So we do work with autistic adults in my lab as well, and filling out questionnaires can be challenging even for folks who have really high verbal skills because of a desire to be very accurate and be very precise in terms of giving accurate information. There are some strategies that people have been interested in the field in general about teaching executive function skills. We and others have been really interested in whether some of the kind of executive function training that's being developed in general for kids could be applied for kids on the spectrum. There are a few groups that are kind of working on executive function training, and we've published the results of one. We looked a little bit at whether just regular practice with executive function games could provide a chance, just to kind of make those skills a little bit stronger. But then we also wanted to make sure that those skills could be applied in the real world. So going back to your social interaction, we found that it was really important to have a person there kind of facilitating that practice and thinking about how those skills would be applied or which skills could be applied in which situations, to think about some of those higher level elements of executive function. And we actually didn't find clear changes in social ability. At least on average. But we found changes in our intervention related to the ability to kind of be flexible in different kinds of real world situations.
Oh, interesting.
So some of the features of autism related to kind of wanting things to be the same, or being able to kind of shift a little bit more, maybe in situations where a child had been getting stuck previously.
And this is in interventions and tools that are on a computer that are digitized, or are they more interactive in-person games with other people?
That's a great question. So we did computer games in my lab. Other groups have looked at whether flexibility can be practiced in different settings. So one of the other groups that's had probably the most clear and convincing findings really worked on this in a classroom setting. And they worked on those skills in a social context. And so it was really neat to see that they could also see changes in that flexibility. I would say if, the sort of indirect effect of getting stuck less can have potential benefits for your social skills, because if you're wanting things to be the same way, that can make it difficult for you to try new things and maybe be in new situations where you'd be around different kinds of people or have different social opportunities. So we didn't see changes in our short period of follow-up, but you could imagine that having improvements in your flexibility could have some downstream benefits. So I think that's a question that we can still learn more about as a field.
That's interesting.
So in terms of really developing these skills, do you feel like it's a matter of finding the not want to say the best, but effective ways of having the kids practice these skills in a way that's manageable? The expectations are not too much, too little, but kind of that sweet, like they're capable of practicing it where it's not completely overwhelming them, but it's also not too easy for them. Is that a fair kind of just broad strokes idea of what we can do to help kids with autism?
That's a great question. So our games were actually individualized. So everybody started at a really easy level, and then the games jumped up to more difficult levels depending on what the child was able to do. So our games kind of snapped to that level that was more challenging. And we think that that's similar to what would happen for kids who aren't on the spectrum. So there's some research that shows that practice can potentially improve your skills regardless of where you're at. You could enhance your existing executive function skills by practicing. But we use executive function skills in new or complex situations. And what's new or complex depends on what you can already do. So if you're trying to develop those executive function skills, I think just based on how we understand executive function, you're going to want to be using skills where you are doing new or complex things for you. Otherwise, you're not really using executive function, and so you're not giving your system a chance to practice.
Oh, that's such an important point. This is why I really love, again, going back to Maria Montessori and her model. She worked with individuals in Italy who have neurodevelopmental challenges and diagnosed disorders. And she created this pedagogical structure that really started with the concrete and then built in these levels of scaffold and support to practice and learn. So the way you're describing it, it's like, we need to start with building the language, building the expectations, and then shifting and adapting those expectations as the skills grow. And this is what I love about executive function. I always say, I'm like, these are skills that we can grow and develop our entire lives, regardless of pretty much anything else that we might have been born with or experiences, that we can find different ways to practice the development of these skills.
Yeah, and Alexis does such a great job with the individuals she works with to explain, oh, that's what this is. This is a skill. Oh, that's what's happening right now. I'm having a hard time shifting, or I'm having a hard time planning with a paper I have to write, or with an assignment or a project. And I think, Lex, you do a really good job of finding that sweet spot of, okay, this is what they can manage to practice a skill. It's not too much, it's not too little. And I feel like in society and like in the classrooms and just parenting, it's just, I think it feels like it's hard to find that sweet spot to challenge someone just enough to practice something. And as you said, to practice it in different contexts, because if it's the same context, to me, that's just a habit. It's not a skill anymore. You're just doing something as a habit, and you really have to kind of change the context. And especially when the fact that so much of youth are using technology and it becomes one context that they're using executive function skills, when there's so much outside of a computer screen that exists that is a different context. And if you don't do something, outside of technology in the real world, you can't really get better at it if you're not experiencing it or using those skills in different contexts.
Yeah, I think from an intervention perspective, I do use computers sometimes, and I've really thought a little bit about this both in general and then what it means for autism. So, with kids on the autism spectrum, a concern, even with face-to-face kind of behavioral interventions, there's been a question, I think, in the field for a long time about whether those skills translate to other settings. We call that generalization. And it's a particular concern with computer games, if we're using those computer games to try to develop or, enhance someone's skills, because so many of the kinds of situations that we've talked about today where you're using your executive function aren't getting something figured out just on the computer by itself. So, if you're, I like to think about sports a little bit. If you're thinking about learning a new sports skill, there may be like a time that you're in the batting cage and you're just doing a lot of reps with something, or you're, like someone, is volleying and you're practicing your tennis, where it's a very focused set of practice, but then you have to be able to put that back into the game situation where there are other demands. And so I think about that computer maybe being like in the batting cage a little bit. I can get a little faster, I can get a little stronger, and then that's going to improve my game. But ultimately, I need to kind of take it back out in the real world. So that's where I think some of our where we kind of came in to think about that complementary coaching. So the coach is there in part to make sure that kids are at that spot where they need to be, that they're not getting too frustrated or stressed out by what they're being asked to do, that they're not kind of sailing through and doing things that are too easy, although the computer does that a little bit for us. And then really thinking about how that information is being applied. So in between rounds of the game, kind of stopping and, taking a break and talking about how those skills are being used and reflecting on the executive function skill. And I think at least in my mind, those are hard to take apart. It might be possible to do just the person part. And I think there are other groups that have done that. But I think it would be difficult for me to imagine that the computer would be enough, particularly for kids on the spectrum.
Yeah. Go ahead.
I was just going to say, well, first of all, thanks, Jared, for the compliments, but I appreciate the complementary coaching piece and building in the points of reflection, right? Because it's one thing, again, like you were saying, Jared, to develop a habit that feels like you're practicing and learning, but that point of like pause to reflect, like that in and of itself is an executive function skill, like activating your inhibition. And if that's built in as part of the practice, whether you're digital or otherwise, I think that's all really helpful work to be done, especially for kids that are on the spectrum.
Yeah. And we've really thought a little bit about like what the next steps would look like. Yeah. So our study that we've done so far is just a really little pilot study with a very brief intervention. I think we wanted to really expand out the role that parents would play in helping with generalization. So can we get parents to kind of then continue that conversation? And eventually, we would love for this kind of an intervention to be available right where kids are needing those skills. So maybe in a classroom, or during a period at school, and then kind of going right back in and applying those skills when the practice is fresh and the reflection is like right there, at the forefront of someone's thinking.
Absolutely. I think that's awesome. One of the things that I often recommend to parents is, to practice especially shifting and cognitive flexibility is to take a game that they're often playing with their kids anyway and introducing a new rule, right, before you start playing, or have the kid introduce a new rule. And it just kind of changes the situation a little bit, that they're comfortable, they've practiced, they're together, but it's just like a shift enough that it feels like it's fun. It even can be, playing I Spy when you're like waiting for something. I call it distracting from the distractions, that if you're distracted from the discomfort of standing and waiting somewhere, that you can distract from that and do something that also could build skills, right? Like, okay, we're going to look for something that is green and then change the rule and say, what's something that you hear, right? Just helping them to shift a little bit in like kind of less, lower stakes situations, which is kind of cool.
Yeah, and I wonder if that could go back to some of the sorting. If there's a young autistic child in your life and they're interested in sorting, I'd be curious if they could sort, maybe if they're sorting by species or by size, could they sort based on color or something different? Which one is the loudest?
For sure.
Or the fastest, different characteristics, because that would be a great way to kind of pause.
Totally.
And then apply some of, a different rule, which is executive function.
Yeah.
It's great.
Yeah.
These are great. These are great ideas. And, last episode, one of our episodes, we talked about parenting a child with anxiety. And one of the things we talked about, and there's research on this, is that when an adult sees a child who's anxious, their initial response is actually not to encourage them to do something that's hard, but to actually support and soothe them. And so I'm trying to take the perspective also of the parent, where what we're talking about right now is how do you scaffold a child to help practice a skill that's hard for them, where it's not too hard, but it's not too easy, when like kind of that sweet spot, which is really difficult to figure out how to do that when things are moving and there's a lot of other people involved. But if that is the goal, I'm imagining if you have a child with autism, if you're a teacher, right, the emotional reaction could be pretty strong when maybe the child is pushed too hard, or if they kind of outside of their comfort zone too much. And I wonder if that's part of what makes it difficult to develop these skills, is that there's kind of like the off switch, it's just kind of like I'm shutting down rather than practice again or try a different way of practicing, because the child's so emotionally activated, and then the adult is also emotionally activated. I don't know if I want to try that again. It's not very rewarding to try something that didn't work and someone's mad at you. It's hard to be motivated to try that again or try a different way of doing it, which people who work with people, the adults and the professionals, we give so much appreciation to the patience and the dedication to helping these individuals.
Absolutely.
Yeah. So a couple of thoughts about that. My team is actually doing a study right now where we're looking at that exact strategy for helping kids who have autism and co-occurring anxiety. And we're working with preschoolers. So, thinking about what that might look like, what the emotion regulation challenges might be, finding that sweet spot of very tiny, in some cases, incremental changes can take a lot of thought. I think parents know their kids really well, more, better than anybody else. And so when we're doing that with my team, we're really working closely with families and caregivers to really figure out exactly what those baby steps are going to look like. But I think it can also feel good for parents to have an expert there to predict that, this may be challenging, and here's what could happen, and provide some support for the parents' level of stress when they're a little bit out of their comfort zone as well. So I think it can be a great partnership to work with a professional around some of those same kinds of changes. And then thinking about the kinds of things that we work with, some of them, are related to doing things in a more flexible way. So to bring it back to executive function, I think, some of that anxiety comes from the world and people in the world being unpredictable. And so getting gradually more comfortable with novelty is something that some of our families are really focused on working on with their children.
Nice. Love that.
That's awesome.
Great. Well, we're getting low on time here with our interview, which is just fantastic. I do want to ask a general question to give you some flexibility, shall I say, to share any interesting findings in the field of autism that really struck you, or that you feel like, oh, there's some movement around understanding autism a bit better, or just something that helps us to understand someone with autism a bit more and to supporting them.
Yeah, this was a hard one because there are so many interesting findings. And I've been in the field for a while. So I think taking the long view, a couple of areas that I think have been really important and exciting for me to see are thinking about how much more we know about what the early development looks like in autism. We have invested a lot of research effort to be able to understand that. And I think that's been a really valuable goal in terms of being able to identify children who are on the spectrum earlier. That has certainly changed in the time that I've been in the field and in our ability to kind of recognize autism earlier and help start to provide some better supports for kids as a result.
Are you suggesting there's assessment tools that have been developed that are more precise, or is it more just the way in which we're utilizing resources to assess?
I think we've adapted some of our tools and we've been able to figure out how to screen and feel more confident with identifying children at an earlier age. So that I think has been really impactful for the field. And I think we are seeing what I would call more positive outcomes on the spectrum. So in the time that I've been in the field, I think we've seen kids who are benefiting from some of those services and more able to engage in a meaningful way with their environment. So, and just have, a wider range of abilities and sort of skills that they can bring to life. So that's been really exciting. We see differences in the brain and in behavior even before children's first birthday in children that go on to receive an autism diagnosis. And so really being able to understand some of those early markers is moving us closer to understanding how autism unfolds and what kinds of things might be involved in contributing to developing autism. And so I think that's exciting and interesting as well. And then I think we've made a lot of progress in terms of the interventions and supports that we are able to offer as a field. We have more things that are available, a wider range of services and services to support people at different ages across the spectrum. It's a neurodevelopmental condition, so we see autism really early in development, but we also see autism throughout the lifespan. So people who are on the spectrum often remain on the spectrum and continue to have that profile of functioning. And so we've also made a lot of progress in maybe the last decade or so in being able to better support autistic adults and really collaborating with autistic adults to do research that's more meaningful to the autistic community.
Meaning they sort of have a voice to express their experience with it?
Yeah, definitely. And I think that's really strengthened our work as a field to think about how we can be more inclusive and provide services that are going to be more appealing to families and to autistic people. I think we're making a lot of progress. I think we still have a lot to learn, I will say. So, we would like to be able to individualize the care that we give better. We talked a little bit earlier on about how there are different profiles of executive function, but I think there are different kinds of autism with a lot of different potential factors that contribute to the development of that profile of autism features. And so I think we would like to know a little bit more about the course of different kinds of autism and what services would be the best to support people with different profiles.
Yeah, interesting. And people with autism, as much as you're saying, they have different profiles cognitively. They are also human beings. They have different personalities, I would also say.
Yeah, absolutely. And that's been, really fun. My lab works with people up through kind of early adulthood. So we have a study that's just winding down that includes people up to age 35. And we've also, as I mentioned, been doing work with children as young as age 2. So thinking about all of the different personalities and different profiles that we see, and some of those different cognitive and executive functioning profiles, but again, different kind of social styles as well, has been really fun. And it's, I think it's a fun challenge to kind of think about how we would individualize some of the care and support that we provide.
I'm really curious to ask you this question. And, we always try to think of what assumptions do we make about people? And I think maybe one of the assumptions that may be out there in society that may not be correct, and I want to hear from you about this, is that someone with autism doesn't necessarily want relationships, that they're sort of, quote unquote, in their own world, and okay with kind of living, just doing things on their own, right? And so can you share a little bit about that? I'm just curious what you would have to say about that.
I'm really glad you asked that, because one of our studies is actually a study that I think speaks to one of the needs that many autistic adults articulate when they're asked, and that is the desire or interest in having romantic relationships. And so that's something that we're working with the autistic community to try to provide support for developing healthy relationships. But I would say that from the autistic adults that I've talked to, and even, some of the children, from what we see in terms of their behavior and in terms of what they describe themselves, that many people on the autism spectrum are very interested in what other people think, really making other people feel good. They're interested in having relationships. They really want to do right by those people that they're having relationships with. And so I think, that's a myth, I think, in many ways. I think there's a range, probably in the population in general of how kind of socially motivated people are, even who aren't on the autism spectrum.
A good point.
I think we see some differences with people on the spectrum, but I would say many of the people on the spectrum, and the data support this, are interested in having romantic or intimate relationships as adults.
Yeah, definitely. And certainly something they may need support with too, as we talked about, because it could be a lot of nuance to relationships. I have another question. I think it's important to, on some level, address this, is that over the past decade, there was a shift between saying a person has Asperger's syndrome versus they are on the autistic spectrum, which is all-encompassing, including kids who used to be labeled as having Asperger's. That term is no longer used in our field. And there probably is a lot of confusion around that. So I'm wondering if you can speak to maybe just clarifying what that means, or how the layperson can understand that, if that's helpful. It seems to be something that happened, and there's a lot of people obviously talking about it and maybe have different opinions about it.
So there is a diagnosis of Asperger's syndrome that would describe someone who has many of the same kinds of features as someone who we would think of as kind of being classically autistic. Some differences in social ability, maybe some differences in ability to kind of be flexible, or that behavioral flexibility. And the difference really was that for someone who received a classification of Asperger's syndrome, that they don't have any cognitive, so like IQ differences or developmental delays, or language delays or difficulties in terms of verbal reasoning ability or the ability to kind of generate language. Although there may be some subtle differences in the way that words get used in conversation. That is something that was required, like that difference in the language and cognitive functioning is sort of a lifespan criteria. So no delays when the person was younger, and no current delays or difficulties in either of those domains. The reason that we don't have that classification anymore is that there's a lot of overlap with other people who would meet the criteria for autism or autism spectrum disorder. And clinicians weren't very consistent in their application of the criteria. And so we don't have a lot of information to suggest that there are either reliable distinctions or that those two groups had either different intervention needs or different outcomes or different sort of factors that would contribute to having a profile consistent with Asperger's disorder or autism.
And a big function of the DSM is actually to inform intervention, essentially, right? Thank you for explaining that. I think it's helpful. I think it kind of happened, and maybe the layperson isn't even aware that happened. And certainly people within the community and parents who have a child with autism, I think it's been a pretty discussed topic for sure about why it happened and so forth.
Yeah. And one thing, just to be clear, I think that cognitive ability is a reason that people are very committed to maintaining sort of an Asperger label. But it's also possible to have autistic disorder in that kind of classic previous diagnostic manual without cognitive difficulty as well.
Right.
And so there may be people who look very similar who would meet criteria for one versus the other just based on their developmental history, but their current functioning could look very similar. So I think there's a range of cognitive ability that we see on the spectrum. So some people on the spectrum have co-occurring intellectual disability as well. But we sort of think about those as two separate overlapping categories where some people will have autism alone and some people will have autism plus intellectual disability.
Right. And so it really speaks to the overarching theme of your lab, and what you're looking at is that there's individual differences, and it's important to look at each individual based on their profile rather than generalize and to see, essentially differences. And that applies to any type of mental health condition that we can think of, that there's differences. And our field is trying our best, right, to understand those differences and to act accordingly, which takes time to understand.
Yeah.
So as we wrap up, just thinking about maybe a last thought for parents, caregivers, and educators who are trying to better support their child with autism to develop and improve their executive function skills. Any advice that you might lend to them as, one takeaway that you think is most important for them to hold on to and remember?
Yeah, I think it might be a two-parter. So I think it's going to be really understanding that individual child's profile and really kind of looking at some of the things that we've talked about today to get a sense of what the strengths and challenges within executive function might be. And then thinking about giving that child opportunities to be in situations where they're problem solving, where they're doing things that are new or that require more than one step. You can scaffold that, but I think giving them a chance to really develop some of those problem-solving skills with some independence can be helpful, not only for developing those cognitive thinking, executive functioning skills, but also for helping kids get a sense of stronger self-efficacy and self-confidence. And so, I think developing, mastering, being able to apply skills and solve problems and figure things out is actually intrinsically rewarding. Even if we don't get a big cookie at the end of it, it helps us feel like we're able to do things effectively and gives us confidence to tackle even bigger and more challenging problems. So I think there may be, again, situations where we need to provide some support or scaffolding, or maybe some concentrated practice with certain parts of those executive functioning skills. So thinking about little cues or hints or reminders, let's slow down, or what do we remember? Or, those kinds of prompts, but then letting the child kind of think through the problem on their own and try to come up with a solution.
That's such great advice. Yeah, I often say get curious and remember that all feedback is information that can help us to guide and grow. So I love that. Thank you so much for sharing. And thank you for being here with us. Just a wealth of information. I have so many more questions that I'm sure we'll have another opportunity to talk about, but just really grateful for all of the work you're doing, just the care that you give, not only to the people that you work with and to the studies that you create, but in the way in which you disseminate the information and inspire so many others to do better and to improve the way in which we support and create interventions to support individuals with autism. So thank you for everything.
Oh, thank you so much. It was really fun to be here. I love this conversation.
Thank you, Susan. Just wonderful. I'll just echo everything Alexis said. To dedicate your life towards helping people, especially people who are misunderstood and maybe even underserved in some capacity, is a wonderful thing. So I echo everything Alexis said. Thank you for doing it, and the way you do it too. You're very thoughtful about it.
Yeah, thank you. I wanted to say thank you to the families and the autistic people who kind of feel safe enough, or are willing to take a big enough risk to kind of come in and share themselves with us and contribute to research. We really view it as a partnership, and we're trying to work together to improve people's lives, but it wouldn't be possible without that partnership. So thank you for anyone who's participated and helped us kind of come closer to some of these answers.
Absolutely.
Beautifully said. Thank you.
Thanks for tuning in to the ReidConnect-Ed podcast. Please remember that this is a podcast intended to educate and share ideas, but it is not a substitute for professional care that may be beneficial to you at different points of your life. If you are in need of support, please contact your primary care physician, local hospital, educational institution, or support staff at your place of employment to seek out referrals for what may be most helpful for you. Ideas shared here have been shaped by many years of training, incredible mentors, research, theory, evidence-based practices, and our work with individuals over the years, but it's not intended to represent opinions of those we work with or who we are affiliated with. The ReidConnect-Ed podcast is hosted by siblings Alexis Reid and Dr. Gerald Reid. Original music is written and recorded by Gerald Reid. Editing and recording was done by Cybersound Studios. If you want to follow along on this journey with us, the ReidConnect-Ed podcast will be releasing new episodes every 2 weeks each season. So please subscribe for updates and notifications. Feel free to also follow us on Instagram at ReidConnect-Ed podcast. That's ReidConnect-Ed podcast, and Twitter at ReidConnect-Ed. We are grateful for you joining us and look forward to future episodes. In the meanwhile, be curious, be open, and be well.